Adlerian Counseling. The proponent, Alfred Adler. Here are the basic concepts or viewpoints of Adlerian counseling. Individual psychology assumes that people are motivated by social factors, are responsible for their own thoughts, feelings, and actions, the creators of their own lives, and are impelled by purposes and goals. To help the client change, Adlerian therapists may use a number of active techniques that focus to a great extent on changing beliefs and reorienting the client's view of situations and relationships. The first one is life tasks. There are 5 basic obligations and opportunities: occupation, society, love, self-development, and spiritual development. All of these are used to help determine therapeutic goals. The second technique is interpretation. Adlerians express insights to their clients that relate to a client's goals. The interpretation often focuses on the family constellation and social interest. Third technique is immediacy. It is communicating the experience of the therapist to the client about what is happening in the moment. Fourth is encouragement. It is an important technique used to build a relationship and to foster client change. Supporting clients in changing beliefs and behaviors is part of encouragement. Fifth technique is acting as if. Clients are asked to act as if a behavior will be effective. Clients are encouraged to try a new role, the way they might try on new clothing. Sixth is catching oneself. In this technique, clients learn to notice that they are performing behaviors which they wish to change. When they catch themselves, they may have an aha response. Aha response is developing a sudden insight into a solution to a problem as one becomes aware to one's beliefs and behaviors. The eighth technique is avoiding the tar baby. By not falling into a trap that the client sets by using faulty assumptions, the therapist encourages new behavior and avoids the tar baby, or getting stuck in the client's perception of the problem. The ninth technique is the question. It is asking, what would be different if you were well? Was a means Adler used to determine if a person's problem was physiological or psychological. And the last is paradoxical intention. It is a therapeutic strategy in which clients are instructed to engage and exaggerate behaviors that they seek to change. By prescribing the symptom, therapists make clients more aware of their situation and help them to change. For example, a client who is afraid of mice may be asked to exaggerate his fear of mice, or a client who hoards paper may be asked to exaggerate that behavior so that living becomes difficult. In this way, individuals can become more aware and more resistant from their symptoms. 11th is spitting in the client's soup. It is making comments to the client to make behaviors less attractive or desirable. And 12th is homework. Specific behaviors or activities that clients are asked to do after a therapy session. And the last technique is push-button technique. It is designed to show patients how they can create whatever feelings they want by thinking about them. It asks clients to remember a pleasant incident that they have experienced, become aware of feelings connected to it, and then switch to an unpleasant image and those feelings. Clients learn that they have the power to change their own feelings. Adlerian therapy is also called the Adlerian Brief Therapy, or ABT, and is composed of 4 phases. First phase is establishing the relationship. It is working collaboratively and being caring, involved, and supportive. It's making person-to-person contact rather than starting with a problem. The second phase is exploring the individual's dynamics. It can be subjective or objective. The subjective interview is composed of active listening to help the client tell their story as completely as possible. And the objective interview is gathering info as to how the client's problems began, precipitating events, medical history, social history, reasons for choosing therapy, coping skills, and a life assessment. The third phase is encouraging self-understanding and insight to help the client understand the motivations in their life, understand how they are contributing to their problem, and making adjustments to correct the situation. Finally, the last phase is helping with the reorientation. It is putting insights into practice, encouragement process, change, and the search for new possibilities and making a difference.